From our 22 News Broadcast Center, this is 22 News in Focus.
Good Sunday afternoon and welcome to 22 News in Focus. October is Breast Cancer Awareness Month, and while many of you may know that because of the pink you see people wearing in the community, you may not know what you or your loved ones should be doing to detect or prevent cancer yourself. And that's where 22 News in Focus comes in today. Today we have a very special program lined up with one inspiring woman after another. While we'll hear from women, it's important to note that this is a disease that impacts men as well. So today everyone can learn from our guests. We'll hear from those who have beat cancer and those still fighting the fight. But first, before we start hearing their stories, let's find out who's most at risk. Joining us now to talk about breast cancer and detection, we have Dr. Holly Mason, the Director of Breast Services at Bay State Medical Center. Thank you so much for being here.
You're welcome. Happy to be here.
Yeah, well, October is Breast Cancer Awareness Month. It sort of gets the wheels turning, allows people to do some research and see what they need to do to protect themselves. Let's start with who's most at risk for this. Who are the people who should really start looking into this themselves?
Well, any woman is at risk for breast cancer, and we know from statistics that 1 in 8 women over the course of a lifetime may be at risk. Now, the older you are, the greater that risk. So someone who's 40, her risk is much less if you look at that particular year than someone who's in their 70s and above. But we all really need to be careful and diligent, and certainly we worry about family history as well, primarily first-degree relatives, but really we should all be cautious.
Okay, and this does impact men as well. This is something men need to pay attention to.
It does. 1% of all breast cancers that we see are in men. Now, the difficulty with men is that they're not typically screened for breast cancer, and they're not routinely talked about with their primary care physician, and so they need to be aware as well.
So what are the warning signs of breast cancer?
Well, oftentimes there aren't any, and oftentimes we pick it up on screening imaging, such as a mammogram. But, you know, sometimes a woman may feel a mass in her breast, may notice that it looks a little bit different. Rarely do they complain of pain. Pain actually is usually more a sign of something that's not cancer, but any change in the breast is something that's worthy of evaluation.
Okay, so you mentioned detecting a lump on your own. So what is the difference between a healthy lump, something that's normal, that should be there, and one that's not? How will you know the difference?
Well, it's actually quite difficult, and so a lot of effort goes into trying to educate patients. You know, in women who are still having menstrual cycles, the timing of the lump in relation to their menses is important. Certainly a lump that comes and goes during their menstrual cycle is more likely to be benign than not. Something that kind of moves around may be more likely to be a cyst or benign growth versus a lump that just kind of sits in place. But I wouldn't necessarily say that if you find a lump on your self-exam that you should just decide on your own that it's benign or it's not benign. The important thing is to sort out that it's new and that it remains. And if over the course of a menstrual cycle the mass persists, then that should be something to be evaluated. In women who are postmenopausal, obviously they're not going to have the hormonal shifts that you see in premenopausal women. So once they realize that this lump is new, and again that it persists over the course of a few weeks, stays in place, then I think that's worthy of evaluation.
Okay, there's been a great debate as to how old you should be when you start getting mammograms. So what is your opinion on this?
There is a lot of controversy about that topic, and part of the problem is that the studies that have been done looking at screening mammography have not necessarily been well done studies. And a lot of the controversy goes into your opinion concerning those results. You know, I'm a breast cancer surgeon, and I see a lot of breast cancer, and certainly I feel that the earlier the stage at diagnosis, the better the patient may do. And certainly since the institution of screening mammograms at age 40, we did see an increase in the detection of early stage breast cancer. Now, although you know, long-term survival impact has not been as clearly proven, I still think women should start early. And so the current recommendations by many of our national societies are to start at age 40, every 1 to 2 years. There are other feelings that perhaps you should start at age 50. The bottom line is I think that every patient, every woman, once they reach 40, should have the discussion with their primary care physician about whether or not to start screening mammography, at what age and at what interval.
Have you ever heard any myths about mammograms that you would like to dispel? I've heard, you know, just a couple of concerns from people that it hurts, it's very uncomfortable, that a mammogram can actually spread cancer. I don't know if you've ever heard of that before, but is there any truth to this?
There's absolutely no evidence that a mammogram will spread cancer or cause cancer. That is something I hear about the radiation associated with mammograms. Certainly the radiation doses are as low as we can make them and still have the image being meaningful, meaning being able to detect cancer. I think there's no question that a mammogram is uncomfortable. And certainly what time in your menstrual cycle you might be may make it more painful or not. I think the bottom line, though, is that it is our best screening tool for breast cancer. There are other modalities, but they all have issues with them. And there are certain things that mammograms detect that no other study is good at detecting, like calcium deposits. So I would still recommend doing the screening mammogram. It is only a very short interval of discomfort. The actual study itself is not very long, and I think the value and the worth of it makes it worth doing.
What can people do? Is there anything that people can do to really prevent breast cancer?
There's not a lot of specific things that you can do to prevent breast cancer. Certainly, you know, estrogen exposure is thought to be at risk, so maintaining a healthy weight, diet and exercise are very important in that.
And what about stress? Does stress play into this at all?
There's no good studies that say it does play into it, though I think stress plays into our overall health and our ability to maintain a healthy weight, incorporate exercise into our lives. So I think it's all interrelated. It's not just one thing or the other.
And you said about 1 in 8 women, I think you said at the beginning, 1 in 8 women will get breast cancer. How have those numbers changed over the years?
Well, I think the issue is that our life expectancy is getting longer, and whereas the numbers used to be lower because women were simply not living as long, but now that 1 in 8 number goes to assuming that you'll live to age 90. So as we get older, your risk does increase.
And what is the survival rate?
Well, that's a hard question to answer because your survival rate depends upon the type of cancer you have, the type of medical therapy that you have, and your overall health. But the survival rates are getting better, again, as we find earlier stage breast cancer and as our medical therapy for breast cancer improves. So even when we see advanced cancer, the medical therapy has improved so much that those women are doing very well.
Do you find that more people will come to you and start asking questions when there is some high-profile, you know, case? You know, recently Joan London came out as saying that she has breast cancer or is fighting breast cancer. You know, October Breast Cancer Awareness Month. Do you find that people will come to you when they hear these stories or are exposed to some of this information?
Certainly, we see
an uptick.
Yeah, we see an uptick whenever there is something in the news, such as Joan London or Angelina Jolie with her risk reduction surgery. We do see an increase in questions. I think the important message for patients is that although we have standard treatments, we do individualize the treatment for the specific cancer and the specific patient. So oftentimes I'll see a patient and I'll make my recommendations, and the question I get is, well, but my friend had breast cancer and she received chemotherapy. Well, you might not need chemotherapy. You might have a completely different cancer and you just need anti-hormone therapy. So I think the big message I have to impart is it's not a rubber stamp. It's specific treatment targeted to your specific cancer.
And how long does treatment usually go on for if someone is diagnosed?
Well, it depends. Obviously, surgery is a part of treatment. Radiation may or may not be, depending upon what we've chosen for surgery. And radiation typically lasts about 6 weeks. In terms of medical therapy, many cancers utilize a woman's hormones, estrogen and progesterone, as an energy source, and there are pill form medications that will block that ability. And that treatment typically is 5 years, though the length of treatment is being actively studied, so that may change. Chemotherapy, there's different regimens. It's oftentimes between 4 to 6 months, depending upon what regimen someone is placed on.
What would you say to those women who are sitting home and maybe haven't considered getting a mammogram yet? You know, they're in the age bracket that you were talking about, or even older, you know, who are just feeling fearful about getting in on that process and going down that road and, you know, becoming a part, you know, starting to get their annual or, you know, every 2 years a mammogram. What would you say to those people who are just hesitant about getting started?
I would just encourage them to talk to their primary care physician about their fears and their anxiety. There's no question, many women fear an abnormal result, but the majority of women do get a normal result, and then they can feel good that this is not something they have to worry about at this time.
Doctor, thank you so much for coming on. Dr. Holly Mason, Bay State Medical Center, you have some great information to share. I really do appreciate you coming on and sharing all this knowledge. Thank you so much.
You're welcome.
And we are going to hear some personal stories of women who have lived with breast cancer. Stay with us. You're watching 22 News in Focus. You're watching 22 News in Focus. Today we're talking about Breast Cancer Awareness Month. We just talked to a doctor about diagnosis and treatment. Now we're turning to some personal stories from people who have survived or are currently going through treatment. Joining me now to share her story, we have Marilyn Ishler, a two-time breast cancer survivor from South Hadley. Thank you so much for being here.
You're very welcome.
You know, we were just talking to the doctor about some fears that women may have starting to get mammograms. You know, it really is so helpful to hear people's stories, and I appreciate you coming on and talking to us. Tell me, when were you first diagnosed? Take me down this road.
I was first diagnosed in my late 30s. I had previously had lumps that I felt, and they were cysts. They were removed, but this time the radiologist had trouble hooking the tumor, and he said, you don't get it this time, we're going to send you home. It hasn't grown, it shouldn't be cancerous. Next thing I knew, I was waking up in recovery.
Oh my gosh.
And at that time it was Midwest, and it was the smallest cancerous tumor they'd found with a mammogram. So I am a firm believer in mammograms.
Now, do you have a family history? What made you go and do that in your 30s?
Well, actually, when I started going to Medical West because of work insurance, my doctor said, you should have a mammogram as a baseline. And then I waited and waited and waited, and he came in and he sat down and he took my hands, and I went, this is not good. But that was when I had the lumpectomies, the cysts. And so I was going back every 6 months just to be sure. And in '91, right after my husband and I had come back from our honeymoon, I was diagnosed with cancer again. And this time I was through the Rays of Hope. I had a lot of support. In fact, I had put cancer so far in my back burner of my thoughts that when I was going in for knee surgery, and you're supposed to list all your surgeries, I left that one off. My husband had to remind me. Wow. But when I got it the second time, which was also very, very small, had to be from the mammogram, I said, that's it, you're going to take them both off. I don't want to deal with this again. I had had a cousin on each side who started with breast cancer, and it moved, and they died. And through my oncologist, I was tested, given the BRCA test, because I have 2 daughters, and so they are safe from me giving it to them, and also my son. But I think I just thank God I'm one of the very, very, very lucky ones. With the first cancer, it was a lumpectomy and radiation, and it got put behind me. I went back to work, and that was that. The next one caught me by surprise. It was like 19 years. I shouldn't be having another one. So
What was that like getting word of that again? I mean, was that
that was actually, I think that one was more shocking than the first one. First one, my surgeon, his dad was dying, so he called my husband, and my husband had the joy of telling me. And I told him I wasn't believing him. And the night before, it was funny, the night before my surgery, I had, because it was in December, I had stacked up all of the gifts that needed to get mailed and gone to bed, and the tree fell over.
really?
And thankfully, my son was there with some of his friends, and they put it back up. I just looked at it as God's way of saying, relax, you'll be okay.
Oh my goodness! Now Christmas, I know, has a special place in your heart every year. Is that
Yes.
that's something that sat with you for some time, right?
Yes, oh, Christmas is my holiday.
What
But
has
it
this?
didn't ruin it.
Yeah. What has this road been like for you? You know, being diagnosed twice. I know that you're now very involved in the community. We're going to be talking about Rays of Hope later on. There is an event coming up later this month. What has this road been like for you?
It really hasn't been hard. When I talk, as I said, I'm a lucky one. Never had chemo. I've never had to deal with that, as Angie, who will be coming on, and Chrissy. But I didn't, and I think, yes, I'm a two-time survivor, but I'm a lucky one. Both cancers were found very early. They were minute, and I think one was 3 centimeters and one was, 0.3, and the other one was 0.2. So they were small.
So what would you say to those women who are concerned about getting mammograms and going in and starting to get tested? I know that you said you're a big proponent of this, but this, you would probably say, saved your life because you
Yes.
did get it so early.
Yes, it did, because I have read recently that when a tumor grows to the size that you can feel it, you are further along in the cancer, and it's more dangerous. So mine were found very, very early through mammograms, and yeah, they may pinch a little bit, but boy, that pinch is worth your life.
Yeah. What kind of support did you have? Did you join any support groups?
I did with the Rays of Hope. My first cancer was before Rays even started.
Okay.
And when they did, my daughter and I walked a couple of years. And then when I had the cancer the second time, and wonderful support through the Rays, through Bay State, and I just said, I've got to pay back. And so I have my team. Twice ain't nice. And I've had quite a few friends. The last couple of years, I've had the high school football team because of my grandsons, and this year the high school Leo team is joining me.
Right. And what is your prognosis now? How do you view your health? Are you still continually going in? And where are you right now?
No, I go to the oncologist every 6 months, only because I was having bone depletion, calcium depletion in my bones.
Sure.
So I've had to go in for an infusion. But that's the only thing. I feel healthy. And when someone asks how I'm doing, it was just always 2 thumbs up. I won't let it be any different. And keep going.
Yeah, and I know that you said that these support groups were very helpful for you. How did you talk to your family about this? How did your family handle this? I know that that's another element that some women struggle with.
Well, I waited. I told the kids Thanksgiving break when they came home, and said, I'm going to be fine, and we're not going to get all upset
or jump the gun. Right?
No, and I think it's all in how you take it. I could have really gone a bit crazy, which is what I did when I had my first non-cancerous, I found out later, tumor or cyst. It really threw me for a loop because I had a cousin die recently.
Right.
But now it's like, I'm going to beat it. It's not going to get me.
How did you stay so positive?
I think part of it was very small, and it hadn't gone to the nodes. Back in '91, when they checked all of the nodes, and I had a scar from stem to stern under my arm, and I thought I would never raise my arm again. But now it's more modern. The only one node or maybe two were taken just to be sure that the cancer hadn't spread, and that was it. And the most difficult thing was my reconstruction.
I was going to say, how difficult of a decision was that for you? You know,
it wasn't difficult at all because I just didn't want to go through cancer again. And I had been reading, and I chose the belly flap. I figured it's good one way, it gets rid of the fat in the tummy, and
There you go.
it builds up above.
right.
But I was in surgery 31 out of 34 hours during the tornado.
Oh, you're kidding. Oh my goodness.
My surgeon said, you know, we're famous.
Oh my goodness.
But I don't remember anything for like 3 days. The surgery wasn't a problem. It was my blood supply wouldn't stay connected where it was supposed to be. And they had to keep going in and redoing it.
But all in all, this was a successful surgery.
Oh, very.
And you have a great story to share, a positive there. One.
Yes, I do my best to be a positive person.
You are very positive. What advice would you have for women who may be sitting at home and realize, you know, someone who is just diagnosed, maybe someone has a diagnosis that they're dealing with right now? What would you say to them? How do you spread the positive energy?
You have to think positively. Someone who thinks negative, that, oh, this is going to kill me, then it is going to be more negative because you're letting those vibes in. But if you're more positive, I mean, it may not come out as you hoped it would. You may not be as fortunate as I was. But don't look on it negatively. Look on it as God opens a door and he'll be there. When I went in the second time, one of my good girlfriends had knit me a little scarf blanket thing for good luck. And I carried it, and I wouldn't let them take it away from me until I get in. They knocked me out. And I said, you're not.
Right.
And I came out just feeling the greatest peace.
Aww.
I felt like God was carrying me in his hands. And that's when I knew you're going to be fine.
What a nice story. Thank you so much, Marilyn.
You're welcome.
I appreciate you coming on and talking to us and sharing your stories and experiences. I love the Twice Ain't Nice team. I know that you'll be out there. We'll be talking about the details of that event coming up later on in the program, but thank you so much for being here.
You're very welcome.
Appreciate it. And we will have another story of survival after the break. Stay with us. You're watching a very special 22 News in Focus. Welcome back to 22 News in Focus. October is Breast Cancer Awareness Month. We just talked to a doctor about diagnosis and treatment. We also heard a woman's story about being treated and surviving 2 diagnoses of breast cancer. Joining me now is Crystal Schweenard, who is currently being treated for cancer. Thank you so much for being here today.
Thank you for the invite.
You know, we've been talking about how October is so important to raise awareness of this. You know all too well. This is very new to you, I understand. Tell me when you were diagnosed.
I was diagnosed in June. I am the Relay for Life event chair in Chicopee, Holyoke, and our relay was the second weekend in May, and I was diagnosed the 3rd week of June.
So what was that like for you? Did you ever see this coming at all?
I did not.
Okay.
My dog had been trying to tell me something was wrong on my left. And I called my breeder. My breeder was like, you should really get checked out. So I didn't listen. And then when I noticed a mass, I went right to the doctor and I called my breeder back first. And my breeder said, follow up, follow up, follow up. And I did, and went through all the preliminaries, and I was told after biopsy that it was stage 2, possibly stage 3, invasive ductal carcinoma, triple negative.
Wow. What was it like getting that news?
Well, I had to learn real quick what triple negative was, and I had met with my surgeon, who was in the same office as Dr. Mason, and her name is Dr. Cash, and she explained to me what triple negative was. She told me that I had quite a battle ahead of me. It wasn't a battle that I couldn't do.
Take a minute.
It's been difficult. I've had 12 Taxol, 4 carboplatin. I'm on my last 4 of adriamycin and Cytoxan. I have 3 more to go, and then I'll go to surgery.
Do you already have a date for surgery and everything?
I do not. I have to finish my chemo and meet with my surgeon again, and they'll come up with a surgery plan. From my oncologist point of view, it's supposed to be quick. As soon as my numbers come back up, I'll go right into surgery.
And how is your body responding? Have you gotten much feedback on that?
The tumor can no longer be felt with their bare hands, so it is shrinking. I did not go ahead with the lymph node removal prior to chemotherapy, so I will wait until my surgery and find out at the time of surgery if it's in my lymph nodes or not.
Okay. Do you have a family history?
I do not.
You do not. So this was shocking for you.
It was very shocking. I just turned 41. My mother kept telling me, there's no way, there's no way. And there's a way.
There is a way.
There's a way. There's a way for everyone, 1 in 8.
Did you get any kind of understanding as to, why? If there was any abnormalities or, you must have asked why.
I've asked why 100 times, if not 100,000. I work very, very closely with the American Cancer Society, and I do read their statistics, and I fundraise, so they do research. I went into my oncologist being, educated. There is no rhyme or reason. There is no why her and why not her. There is no why you and why not them.
Right.
If there's one message I can send, it's please do not forego your examinations. They will save your life.
Had you had an exam, mammogram or any?
I wasn't at the age yet. So when I had went back for my annual, she said, well, we can do it next year, and because it was in the middle of the 40 and 39 and 40. So when I went back, it was in the middle, and I went as I should have, but I just went a little later because my annual fell later, and then I got the first mammogram, and then I had an ultrasound as well. My GYN doctor didn't want to leave anything out, so I had the mammogram and the ultrasound on the same day. And the radiologist came in, and he said, well, we really want to send you for a biopsy. And they scheduled that, and that was about a week later.
So how has this changed your life? Has this impacted your ability to work? Is this time-consuming? Talk to me about how this.
Well, I wasn't working before, but if I was, I wouldn't be able to now. I have a lot of trouble walking with my left side. My left hip, my left bones, the bones in my left leg and my left foot are really affected by the Taxol, they tell me. They tell me it's going to come back. Okay.
It hasn't yet.
It has not yet. I just finished my last Taxol 2 weeks ago, or 1 week ago.
Now,
I lost all my hair, but that's normal.
You look beautiful.
Thank you.
You look fantastic. How amazing that you were saying that your dog actually tipped you off to this. Did you have plans to go and get tests? You said you weren't quite at the.
No, I wasn't. I didn't have any. Let me get right over there.
Right.
But my dog kept hitting me. I have a Saint Bernard, and they're trained, to find buried people in avalanches. Is what instinctively that's what they do. Right. So my dog used to always walk on my right, and then my dog switched to my left, out of the blue, just out of the blue. And he kept hitting me on my left, hitting me. So I called her and I said, well, why would he do this? Because I built a friendship with my breeder. And she said, he's trying to tell you that something is not right. You have to figure out what it is, or you need to get to the doctor and just get an exam. Start there. And that's what I did about 6 months later, but this was after my husband and myself had noticed the mass.
That is amazing. That really is amazing. Yeah. I know that you're already involved with the American Cancer Society.
I am. I am doing the Rays of Hope survivor part of it because I can't walk the distance. So I will be there on the 19th. I just did strides in Stanley Park this past weekend.
Now I know that this particular event, Rays of Hope, has grown tremendous. Started off with somewhere around 500 and has grown to be thousands and thousands of walkers who do this every year. How important is it to you now? Now, you know, you said you've always been involved with Relay for Life and all that.
I have.
How does this impact you differently
For
this
me,
year?
they are two different organizations. Relay for Life and American Cancer Society focuses on fundraising for research. Rays of Hope focuses on research, but they also have a local, all their funds stay local. I love ACS and I will continue to work my heart out for them because they do research for everyone.
Right.
Where Rays of Hope for me is local, and although I am here local, I still think about the people around the world that still need cancer research.
But just seeing the support, though, having so many people who may not be impacted by cancer themselves coming out and being a part of these events, how that must make you feel really good to see that.
It does, and I think that the more people become educated by going to these events and supporting people that they may or may not know, will continue to raise awareness that needs to get out there for early detection and early, you know, diagnoses and things like that.
Have you found comfort in support groups, or?
I have not attended any. I am quite close with my ACS staff partner and their entire office, and they have been great to me. But as far as centralized, you know, specific support groups, I have not attended those.
Okay. Is that something you think that you'll be a part of, or you just have a lot going on right now?
My oncologist has asked me to look into speaking for Rays of Hope at some point. I'm not against that. I said, let me just beat this first, or can we beat this together first? Right. I know that ACS has a standard that even though you're fighting, you're still considered a survivor. I personally have a different view on that. I believe to be a survivor, you need to beat it. You need to survive, and that's where I'm at now. I'm doing my best.
You're fighting the fight.
My plan is to win, and at that point, I will more than happily be a survivor speaker for anyone that wishes to have one.
Crystal, we're all thinking about you.
Thank
you so much.
Thank
Stay
you.
strong, stay positive. You look beautiful.
Thank you.
Keep fighting the fight. And I hope
Absolutely.
to have you again on the program when you will call yourself a survivor. We'll have you back on for that. Okay.
Thank you.
Thank you so much. I really appreciate it. And we're going to hear another personal story from someone currently in treatment or continuing their survival process as well. Stay with us. You're watching 22 News in Focus. You're watching 22 News in Focus. Today we've been talking about Breast Cancer Awareness Month. Many people will be wearing pink this month and working to raise money and awareness for the sometimes deadly disease that will likely impact 1 in 8 women. Joining us now to share her story with us and talk to us about an event coming up, we have Angie Kazunis joining us. Thank you so much for being here.
Oh, it's my pleasure. Thank you.
I appreciate that. We'll talk about the event in just a little bit because I know that it's one that's grown, and many people want to know where their money's going when they're contributing. So we'll have the chance to talk about that. But first, I just want to talk to you about your story. We've heard 2 very different stories. We heard a 2-time survivor. We just heard from Crystal, who is fighting the fight right now. She even said that she doesn't consider herself a survivor yet, which absolutely broke my heart to hear. Talk to us about your story.
I am a survivor.
And you will call yourself one.
Yes, absolutely.
Very good.
I was diagnosed when I was in my late 50s, and I heard the story that Crystal told where she went for her first mammogram. Believe it or not, naughty me, that was my first mammogram too.
Really?
My husband had been after me for years, telling me how important it was. I dismissed it. I didn't have time for it. Couldn't be me, the never me, that thinking that a lot of ladies have. In my very first mammogram, I was diagnosed with having an issue. Had the ultrasound the same day. They advised a biopsy, and like Marilyn, it was right around Christmas. My biopsy was the day after Christmas.
What?
I had a choice of either the day before or the day after. I chose the day after. And I got my diagnosis that it was, in fact, cancer on Christmas Eve day. My husband was waiting for a phone call to find out the results of the biopsy. And he had just come home from work, and I just got the news about 15 minutes before that. And he said, well, you don't feel like partying tonight, do you? And I said, well, I don't feel like dying. We're partying.
What party?
So I went, and as everybody said, you know, Happy New Year, Happy New Year. What had occurred to me was, gee, I hope it is. And it truly, truly was. I went through surgery at the tail end of January. Fabulous Dr. Mason, who was with you earlier today, did an absolutely amazing job. Very caring individual. Did a great job. Got clean margins, yay. And then I really had the positive attitude that Marilyn spoke about. I committed to my husband that day that I was diagnosed. I'm going to fight this with everything I've got. And I'm a very strong-willed individual, as anyone that knows me will know. And I did exactly that. I immediately researched what I could do to be healthy, to eat properly, to do everything I needed to do to make my body strong to survive this. Had the surgery. I asked the soonest possible that I could start the chemotherapy because they determined that I had to have chemotherapy based on the size of the tumor and the fact that it was in one of my lymph nodes. They knew that prior to surgery. So 2 weeks later, off I went for the chemo. When I knew I was going to have chemo, in my head, I calculated out how long this whole process was going to be, and I knew I was going to be a survivor. I booked a trip to Bermuda.
Oh, good for you.
For the end of it. So I was ticking off the days.
Good for
okay,
you.
so this is chemo, and I'm going to do radiation, and I'm going to get back to normal. Because for me, that was normal. So I did the chemo. I did join Rays of Hope with their survivorship programs and with their support programs, which were tremendously helpful for me. I'm not a groupie, but one of the things that I found with research was that people that do join support groups recover quicker and their incidence of recurrence is less. And have always been a believer in having a positive attitude. So even though there were days where I was maybe so-so, I put on happy colored clothes, unlike today where I'm wearing black. But I put on happy colored clothes. I went to the American Cancer Society, had a program, Look Good, Feel Better, where it teaches you how to make your face look normal by painting eyebrows and eyelashes and putting some color in your face and then taking care of your skin. And every day I cooked all these healthy foods. My husband never knew what we were going to eat for dinner. Sometimes it was oysters, and sometimes it was liver and beets and spinach and all these things to fortify my body because chemo does a job on you. 2 weeks after the chemo was done, I started radiation. Immediately I started on the oral chemo drug, and the entire time I knew I was going to be okay.
Wow.
I had great support through my doctors and through Rays of Hope. I knew I was going to be okay. And today I'm okay.
Wow, good for you. Congratulations. Your story just makes me smile so much because it shows through how positive you were. And you said you were cooking all these meals while you were receiving radiation and chemotherapy. I mean, how do you stay so strong? You know, we were hoping today, putting together this program, that people would hear these stories and feel the strength and feel positive about whatever situation they may be in or their loved ones. Does it really help to hear others who have had a positive experience or who are going through it and some of the steps that they've taken?
One of the things that I did as my approach to my journey, because they call it a journey, I chose initially not to make my diagnosis public. There were only a few people in my life that knew, and I dye my hair. My hair is black. I dye my hair red, and I went to have a new haircut. The page boys stacked and dyed my hair, and that's the day I went for my wigs. I actually got a couple of wigs, and I had my wigs the same style, the same color as my normal hair. And I didn't want to hear anybody saying, oh, this person I know either was very ill or died or all the negative stuff. In my mind, I wanted to be positive, and I was going to keep all the negative stuff away. So I kept it pretty private. Some of my closest friends knew, and then it was amazing to me that people actually approached me and said, oh my God, you look great, you look so healthy. And I was thinking to myself, oh, I don't have a stitch of hair on my head. Anywhere on my body, you're saying I look healthy? You don't know the Civil War that's going on.
Oh my gosh,
but
that must make you feel good.
I think it was my positive attitude that radiated, and that's what I personally needed. And Rays of Hope had so many support programs to really empower me to continue with that positive attitude, and it served me well. Served me well.
I just love that. And I do want to ask, just because I've asked everybody, did you have a family history of this? Is this something you even had a heads up about? No.
No. And that's probably why I resisted when my husband urged me so many times to go for a mammogram. No history, no risk factors. But as we know, sometimes you don't know the why.
Right, right. And that's something we're hearing a lot about just with our guest today. No family history, first mammogram. Amazing. Angie, thank you so much. We are going to continue talking to you. Everyone's mentioned Rays of Hope and these support groups. So I want to talk about that a little bit more in depth when we take a break. So we're going to take a short break and we'll come back and continue our conversation about Rays of Hope and how you can get involved. Stay with us. You're watching 22 News in Focus. You're watching 22 News in Focus. Today we've been talking about Breast Cancer Awareness Month. We're continuing our conversation now with Angie Gazunas, who is a survivor herself and will be participating in an upcoming event. Thank you again for being here and sharing your incredible story. And you know, we didn't even get to tell them in the break, you did go to Bermuda. You took that trip, you booked it, and you went on it. And I think that's great. So I just wanted to let people know that. So we have this Rays of Hope event that happens every October. Talk to us about it. When is it this year?
This year it's October 19th. The walk officially starts in Springfield at 10 a.m., in Greenfield at 11:30, and it's just amazing. I've been doing it, this will be my 5th time, and it's a sea of pink. It's just the energy and, oh my goodness, the excitement is just incredible. There's music, there's different things as you walk. There's bands, there's people entertaining you, there's stops for water, there's little candy breaks. Everybody's cheering you on. They have cheerleaders from the local schools. It's just the most amazing thing to participate in.
Now, why is this important for, you know, we were just talking to a woman, Crystal, who's just received her diagnosis and still dealing with this and, you know, coming to terms with this. Why is it important for, you know, people who may have just received a diagnosis to become a part of these events? These may be hard to be a part of because then you have to admit that it's happening to you, you know. Why is coming together like this so helpful?
When you're diagnosed, I think Crystal communicated this as well as Marilyn communicating this, you're absolutely in shock. You're frozen. Oh my goodness, what just happened to me? And then you try to navigate through the whole process of, what do I do next? Rays of Hope immediately has resources for you to be able to help you to determine decisions, very important decisions with your health, with what you need to do and then how you proceed. They support you as you're going through your illness, as well as you're recovering, because day one, you're a survivor. And day one, you've recovered. And the support at that time is so crucial because your emotions are just churning. There's fear, there's a lot of anxiety. You don't know, am I going to live or die? I hate to say the word die, but it's a possibility. And to see so many people doing this walk and the survivors all wearing pink, and you look around, and I happen to work in the tent, the Pink Hope tent. I've done that for several years. And talking to people, how many years, how many years, how many years? And it's just amazing. And you know, it opens your heart to see these people that have put that behind them. That's pretty scary, and it's real negative. They've put it behind them, and they're living. They're living with their families, and life goes on. And that's the most encouraging thing for someone who's just been diagnosed, and such an encouraging thing for the community, that years ago you hear the word with a C and it's a death sentence. Today it's not. We all are vibrant individuals. We've gone back to normal. We have our lives, we have our families, and we walk. I was on a radio little interview this past Sunday, and I said I'd walk to the end of the earth if we could kick this disease. So we walk.
And you yourself even said that you felt the positivity helped you survive this
Absolutely.
On your journey.
Absolutely.
And just talk to us quickly about how this event has grown and how people can get involved.
It started out, Lucy Giugio Carvalho started the Rays of Hope organization to help people to navigate through this experience. And it is quite an experience. They call it a journey. And it originally started with about 500 walkers. The very first year they raised $50,000, and that was a stellar goal at the time. The walk has since developed. This is our 21st year. It has developed where Rays of Hope, through the walk and other sources, has raised $11.6 million. And last year, from what I understand, was the record. There were 24,000 walkers.
And does that money stay local?
All the money stays in Western Massachusetts. The money goes toward research and outreach and education programs, supporting breast cancer survivors and people being diagnosed with it.
As we've heard today, a lot of people utilized that and needed those support groups. And the website is baystatehealth.org/Rays of Hope,
Yes.
I understand. And we will also have that link on our website as well. So the event is October 19th. Angie Gazunas, thank you so much for coming on and
My pleasure.
sharing your positivity and telling us your story. Thank you so much for everything. And do continue this great work. And we'll, of course, see you on the 19th. And we'll have the last word for you after the break. Stay with us. You're watching 22 News in Focus. You're watching 22 News in Focus, October's Breast Cancer Awareness Month, and today we put the spotlight on this sometimes deadly disease. We heard today stories of struggle and survival. We also spoke with a doctor about when people should start getting tested. We hope you learned something today that may help you or your loved ones. That is our program for today. We want to thank our guests for joining us and sharing their stories. Thanks to you at home for watching. If you've missed any of it, you can watch it in full on our website at wwlp.com. From all of us here at 22 News, we wish you a wonderful Sunday. Take care.